We are at the Buckhorn Children's Home and we are having our Community Health Day,
where we bring resources with a goal of reaching as many people as we can with the COVID vaccine. We've had people here today of all ages, some who have never had a COVID shot, receiving their first vaccine, and that's our goal today.
When the pandemic first started, I wasn't necessarily anti-vaccine. It wasn't a priority for me. About 2 months ago, I had a close relative. He and his family had been to Florida. All of his family members, with the exception of him, had been vaccinated. When they came home, he and his wife and one of his daughters had actually contracted the coronavirus. And for the wife and daughter who had been vaccinated, it wasn't more than a mild cold. But he actually was admitted to the hospital, later to ICU, and was transferred to UK. He ultimately went on the ventilator and a week later died. And so after that, it entirely changed my outlook on the vaccine and what we need to do to fight and to eventually eradicate the virus.
So I was scheduled to get my vaccine the first week it was available to us healthcare workers here at the UK Center. And that was also the same week I found out I was pregnant. So I did hold off for a little bit more data. I spoke with my doctor at UK Healthcare as well and decided to get vaccinated at 19 weeks. Olivia here was the baby that I was pregnant with, and she is 2 months old, and she's doing well. She's meeting all her milestones. Hi. I was hesitant, but it was scarier of what would happen to me if I got COVID and what would happen to Olivia. And I also have a toddler at home, Alex, who is 2. So I didn't want to leave them with just a single parent. For me, it's the best thing you can do to protect your unborn babies.
It's really hard for people to have transportation into a clinic and a time of day that they can come or a time that they can get someone to give them a ride and to get the services that they need. And so today we bring the services to them.
He likes the music in church, sometimes. Yeah.
We are at the Owsley County Elementary School. We are here doing a drive-through COVID vaccine clinic. We just have some booths set up here today. We are offering the COVID vaccines.
This is my mother, Hester.
This is my daughter. Ask her where she lives. With her mommy.
I live with my mom right now. She's 90.
I think events like today are a great opportunity for community partners to come together and educate the public on various health issues. It gives us the opportunity to meet people that we wouldn't normally get to interact with, do some giveaways, door prizes, and just educate the public on various health issues.
The most successful Appalachian Community Health Days that we have had have been led by our faith-based community. Our pastors in rural Appalachia are very important to our communities in relaying messages of importance. When they step up to the plate and say how important it is to get your COVID vaccine, people listen. Pastor Billy Joe Lewis in Leslie County actually helped us set up one of our community health days. He did work ahead of time to let the church know that we were coming and how important it was to get your vaccine. Pastor Lewis had preached a funeral about 2 weeks before we had our community health day at his church. The person died of COVID. And so he was really glad to get us to come bring the vaccine to his population.
We were real hesitant about getting the vaccine at first, but then we ended up catching COVID-19 again. It started with my wife at work. She brought it home. Ran through me and ran through her son. At the time, my wife was pregnant, and you hear all these stories about women having miscarriages due to COVID. So that was a really, real scary part for us too. So we went ahead as soon as we could. We got the vaccine.
The USA Drone Port is working with the University of Kentucky to help promote COVID vaccination.
It's a partnership we started last year in March because of COVID. And we started exploring the concept of how drones can be utilized in specifically pandemic responses.
We're also going to have leaflet drops. Leaflet drops haven't been done since Vietnam. This leaflet drop will hang on the bottom of a drone. You can turn it at any speed you want, but it can drop up to 200 leaflets a minute. We're going to be using biodegradable materials so it doesn't litter everything and stay that way for very long. This is to help people understand that there's free opportunities in their area to come and get COVID shots.
We're very thankful for all the community resources that have come together to help us to have these Appalachian Community Health Days. And that's what we are in Appalachia. We're neighbors and friends, and we can come together and we can bring services to the people in our communities.